Hello, my name is Jodi Coombs, and I'm the Senior Vice President for the Floating Hospital for Children and Women's Health at Tufts Medical Center in Boston. Over the past 25 years of being a nurse, we have seen some real critical changes around how we talk about quality and safety. What I see emerging are key principles that are critically important for nurse leaders to embrace and foster. The focus now is around improvement science and how creating a culture of safety within an organization is critical to creating a highly reliable organization with a primary focus to work across boundaries and to drive to zero patient harm. It takes strong leadership from the top down to put a stake in the ground and say that creating a safe culture is job number one to becoming a safer organization. I remember when I was a new manager and I was finding a lot of safety issues, one of my colleagues from another unit said, "Be quiet, stop trying to find things. They don't want truth tellers. You're making us all look bad." That comment really stuck with me for over 15 years. While I left that day wondering if I had what it took to be a leader, I realize now that comment really reflected a blaming culture and that people would not report something wrong in fear of getting in trouble. Here are some key lessons I've learned. 1, create a positive culture. Work with your staff to develop a culture of learning and trust. Even when bad things happen, seek first to understand before you let your brain go to who's at fault. Break down the fear around safety events being punitive. Foster a fair and just culture. Celebrate near misses. In my hospital today, we use the Good Catch Award. We look at events and we acknowledge and celebrate people who catch events or safety issues before it touches the patient. This has been a cultural transformation and it also has helped to develop trust among the leadership and the staff. Another story I have about how important it is to work with your staff when an error happens is when I was reviewing a medication error with one of my cardiac intensive care nurses. And after reviewing that event, of which she was devastated over, she later revealed to me that she thought she was going to get fired. I closed our meeting with, "Tell me 3 things you did well today." I had no idea how this impacted the nurse for better until 3 years later when she disclosed to me that she wasn't sure if she wanted to be a nurse anymore. But how I showed empathy and respect for her in that moment validated why she loves being a nurse. How you handle even the most critical events can play in a nurse's head and heart forever. 2, be transparent. Understand your unit's key performance indicators and how to interpret the data. Show the data consistently. Use it to tell a story that's meaningful and captures the attention of your staff. Show your staff you're paying attention to incident reports that they're filling out. Many times they get frustrated because they're filling out these reports and they don't think anybody's looking. Show them the trends and graphs with key metrics. Highlight when an initiative was started and you engaged the staff in seeing how they were driving those improvements. 3, engage staff and families. Involve staff and families in problem solving and process improvement that will improve safety. Many hospitals have started to do an excellent job at disclosing to families when errors occur and then working with them and the staff together to make a system safer. Ensure your staff use evidence-based practice to design systems that work to improve the systems that are breaking down and causing safety issues. Invite your senior leaders to your unit to do safety rounds. Ask your staff what keeps them up at night. Also ask them, what have they done to change their practice recently that has improved patient safety? Quality and safety is the cornerstone of delivering high-quality health care, and nurses are critical to the surveillance and coordination that reduce harm to our patients and increase the quality of care we give. As a leader, we need to be the champions for quality and safety, with a primary focus to work across boundaries and teams to drive to zero patient harm.